EGPAF is the Elizabeth Glaser Pediatric AIDS Foundation, 25 years old, started by Elizabeth Glaser with the purpose of saving her children's lives, Jake and Ariel, to whom she passed the virus unknowingly. 25 years later, we're an operating foundation working in 15 countries. We're about 1,000 staff. 90% of whom are in the field. And so our Tanzania office, for example, has 170 colleagues, 98% of whom are Tanzanians, and that model continues across the other countries that we're working in. We're focused on adult as well as pediatric care and treatment. We work primarily through public systems, so we work very closely with ministries of health at the national, provincial, district, and site level. We pay a lot of attention to getting as many people tested and counseled, obviously, first and foremost, but a great deal of attention as well on a really complicated issue, which is getting kids and moms and dads to come back for services, in the case of moms and kids in particular, after they've given birth. What we seek to achieve, our mission is to end AIDS in children. We've done a much better job over the last 5-7 years in reaching adults with care and treatment. We've not done nearly as good a job with kids. There's only about 25% of kids in the aggregate that are identified, tested, counseled, and initiated on treatment. That's just egregiously low. And the infant and under 5 mortality rates reflect that. The global goal of virtually eliminating pediatric AIDS by the end of 2015 it will be achieved in a number of countries. We wouldn't have said that as confidently 3 or 4 years ago when the global plan laying out those goals was launched. But look at Botswana, Namibia. Look at what South Africa has done in the 3 or 4 years. Phenomenal work and leadership and progress. Zimbabwe has done a phenomenal job of rolling out prevention of new pediatric infections all across the country. Just stunning, stunning work. And so the definition in the global plan to virtually eliminate pediatric AIDS is to drop new pediatric infections, vertical transmission, below 5%. They're very ambitious goals, but what about the response to HIV and AIDS has ever been modest or has ever been understated? And while political will matters and the resources are crucial, the activist community, being really loud about what people at the time very often said was unreasonable or unrealistic. I mean, that's what's driven, I think, as much as anything else, the response over the course of 30 years to HIV and AIDS.